in the cervical area. And I said that the cervical plexus has cutaneous branch, motor branch, and communicating branch. And from beginning by now, I am talking about the SCM area.
Yes, sir.
Sternocleidomastoid muscle area. Okay?
Yes, sir.
These branches are located posterior to the SCM. But I said that the cutaneous branch are emerged in the posterior border of SCM and arrive to the anterior to the SCM, to cutaneous, to innervated the skin of the cervical area. Okay? The motor branch. I said that the motor branch was the phrenic nerve. Phrenic nerve has the motor branch and also it has sensory branch. Sensory branch for the pericardium and the parietal pleura. The parietal layer of the pleura. Okay. Another motor branch in the cervical plexus is named ansa cervicalis. You can see the ansa cervicalis in this area. Ansa cervicalis has a superior root and inferior root. And these two roots connect together to make an ansa form. Ansa means
The loop of C1
this is like a C shape. Is named the ansa. So superior root and inferior root. And also they are the roots from the spinal nerves number C1, C2, C3 and inferiorly C4. Okay. The C1, the spinal nerve of number, the C1 spinal nerve travels and connected to the hypoglossal nerve. So it is a communicating nerve. I said that the cervical plexus has some communicating nerve, yes? A communicating nerve is C1 branch which connects to hypoglossal nerve, and then separated from hypoglossal nerve to create a superior root of ansa cervicalis. This branch which travels with the hypoglossal nerve connected to muscle, geniohyoid muscle and thyrohyoid muscle. Geniohyoid and thyrohyoid are the muscles which are located in the floor of the oral cavity. These two muscles connected with the C1 branch which are traveling with the hypoglossal nerve. Okay. Superior root, I said that. Superior root separated from the hypoglossal nerve and connected to inferior root. Inferior root is made by C2 and C3 cervical spinal nerve. These two nerves attach together to make the ansa cervicalis. The ansa cervicalis innervates all the muscles which are located in the infrahyoid area of the neck. Okay? All the muscles in the infrahyoid area of the neck except of thyrohyoid, because thyrohyoid is innervated
C1
by the C1 branch which is traveling by the hypoglossal nerve. Okay? Also, superior root innervate the superior belly of omohyoid muscle. But inferior belly of omohyoid muscle innervated by?
Inferior root.
No, by the ansa cervical. By the ansa cervical. Okay? Ansa cervical innervated all the muscles which are located inferior to the hyoid, which are named infrahyoid muscle, but except of thyroid, which is named by the communicating branch, and superior belly of omohyoid, which is innervated by superior root. Okay? So, what? Superior root is one nerve, every of this spinal nerve except of C1 and except of C5, divided in two branches, superior branch and inferior branch. The superior branch and inferior branch connected together, all of them connected together, and innervated all the muscles of the paravertebral and paravertebral area. Paravertebral and paravertebral area are the motor fiber. They are the motor branch of the cervical area. Also, they may ansa cervical. Look at the ansa cervical, which has superior root, inferior root. Superior root travels by the hypoglossal nerve. Inferior root is graded by C2 and C3. And also I said that it has some cutaneous branch which innervated the skin of the cervix and of the neck, and also the skin of the parotid area and the skin of occipital and mastoid area. Okay? They are the branch of the cervical plexus.
Sir, what are the cutaneous innervation?
I forgot to say that I am teaching you the structure of the SCM level by level, from superficial to deep. Okay? So, ansa cervical is located deep to the SCM. Deep to the SCM. Cutaneous branch are located anterior to the SCM. Ansa cervical is located to the deep of the SCM in the depths of the carotid sheath. In the depths of the carotid sheath. Carotid sheath covers internal carotid, common carotid, and internal jugular vein, and also vagus nerve. Yes. So I can say that ansa cervical, if I ask you, ansa cervical is located anterior or parallel or posterior to common carotid artery. What do you answer? Anterior. Yes, anterior, because it is located in the depths of the carotid sheath, and carotid sheath cover this structure. So, I said that carotid sheath contains three structures. From inferior common carotid artery and superiorly common carotid divided in two branches, external carotid and internal carotid artery, plus internal jugular vein, plus vagus nerve. Okay, these three structures covered by the carotid sheath. Posterior to the carotid sheath, we have sympathetic trunk, and posterior to sympathetic trunk, we have prevertebral muscles. And now I assess all of this structure. I say you the carotid sheath. As you can see here, carotid sheath is located deep to the SCM. Yes, deep to the SCM. As you can see some part from the here. At the superior part, carotid sheath is located in the anterior border of SCM. But in the inferior part, it is completely covered by SCM. See here. Here are the contents of the carotid sheath. Here is common carotid, internal carotid, external carotid. Yes. This nerve. What is this nerve?
Vagus.
Yes, vagus nerve, and glossopharyngeal nerve and sympathetic trunk from this area. Okay. The common carotid artery, and a structure which is located in the carotid sheath. The origin of common carotid artery is different in the left and right. As you know, here we can see the aortic arch. The aortic arch has three branches. The first branch is named brachiocephalic trunk. Brachiocephalic trunk, posterior to the sternoclavicular joint, divided into artery. Yes? Right subclavian and right common carotid artery. But left common carotid artery is a branch which directly originated from the aortic arch. So, left subclavian artery has a part which is located in the thoracic area. Which artery is longer? Left subclavian or right subclavian?
Left subclave.
Left,
Yeah.
because left has some part in the thoracic area. Is longer than
Right.
right.
Right sub.
Okay. The common carotid artery travels superiorly to arrive to the level of the superior border of thyroid cartilage, which we named it Adam's apple, or laryngeal prominence. Adam's apple or laryngeal prominence. In this area, and at the level of Adam's apple, and here anterior border of SCM, the common carotid artery divided in two branch. Okay, divided in two branch. External carotid artery and internal carotid artery.
At the level of
Okay, the level of a line between laryngeal prominence and anterior border of SCM, and you can touch the palpation of the common carotid artery in this area. Okay, if you touch here between anterior border of your SCM and Adam's apple or laryngeal prominence, between these two structures, if you touch deeply, you can touch the palpation of the common carotid area, which is divided in two branches. Okay. So if you want to touch the palpation of common carotid artery, this area, Adam's apple, is located at the level of which cervical vertebra? This area is located at the level of which cervical vertebra? Intervertebral disc, which is located between C3 and C4. Between C3 and C4. So, if I ask you that I want to touch the palpation of the artery in this area, which is located at the level of cricoid cartilage. Cricoid cartilage. I am touching the palpation of internal, external, or common carotid artery. Common carotid artery, yes. Common carotid artery is located in this area from the joint, sternoclavicular joint, until the laryngeal prominence. Okay? We have two important structures related to the bifurcation of common carotid artery. At the level of bifurcation of common carotid artery, you can see a red to brown color, which is named carotid body. What do you think about the function of carotid body? It is located between external and internal at the level of bifurcation of common carotid artery. What do you think about the function of the carotid body? Yes,
Exactly.
it has baroreceptors. Yes? Are you sure? It has chemoreceptors. The chemoreceptors are sensitive to CO2 and O2, and during the increasing the level of CO2, it is sensitive and makes some impulse in the brain. Okay, it is the function of carotid body. The innervation of carotid body are the branch from the vagus nerve and branch of glossopharyngeal nerve. Vagus nerve and glossopharyngeal nerve. Here, at the origin of internal carotid artery, we have a dilation in the lumen of this artery. This dilation is named carotid sinus, And what is the function of carotid sinus?
Baroreceptors.
Yes, it has baroreceptors. It has baroreceptors which are sensitive to the pressure, which are sensitive to the blood pressure. In some patients, they are they have a very sensitive and very functional baroreceptor in the carotid sinus. And if you touch this area, if you touch this area of these people, okay, and massage this area several times, maybe they faint because of the sensation of the baroreceptors which are located in the
Carotid
sinus. And also it is a reason for when you are in a bathroom and you want your friend to massage the cervical area, yes, and you feel very relaxed because you are hypotension at that situation. Okay? So,
What is the location of the
also the innervation of
Accessory.
sinus
Accessory.
is the vagus nerve and glossopharyngeal nerve. This branch to the carotid sinus and carotid body are sensory or motor?
सेंसरी
Sensory.
Sensory.
They are sensory branch. Okay.
इनकी सेंस करते हैं ना फोकस
The external carotid artery. External carotid artery has 8 branches which supply the area of the neck, the area of the neck, the area of the face, and also some part of the skull. Some part of the skull. This area are supplied by the external carotid artery. But internal carotid artery insert to the brain, and any structure which is located in the skull is supplied by internal carotid artery. The branch of external carotid artery. I said that we have how many branches? 8 branches. 8 branches. Okay. See here. It is internal and it is external carotid artery. The first branch, which you can see here, is superior thyroidal artery. The superior thyroidal artery is separated from the external carotid artery below the level of hyoid bone. Here we have the hyoid bone. Below the hyoid bone, the superior thyroidal artery is separated from the external carotid artery, and it's traveled inferiorly to supply the area of the anterior triangle. Okay, the anterior triangle and the area of the muscular triangle, the thyroid gland in the muscular triangle. It has 2 branches. Superior thyroid artery has 2 branches. Superior laryngeal artery. Superior laryngeal artery, which pierces the thyrohyoid membrane, and supply the larynx. Another branch is named infrahyoid branch. Infrahyoid branch supply the structure in the infrahyoid area. So, another artery, as you can see in this area, another artery is lingual artery. Lingual artery and also facial artery. Lingual and facial artery are separated from the external carotid artery at the anterior view. You should know that the branch which are separated from anterior view, medial view, and posterior view. Superior thyroid artery separated from the anterior view. Lingual, anterior view. Facial artery. Anterior view. Yes, they separated from the anterior view. Superior thyroid artery is separated below the hyoid. Lingual artery is separated at the level of hyoid, at the level of hyoid bone. Also, facial artery sometimes may be communicated to the lingual artery, and they have one trunk sometimes, but usually they have separated trunks which are very near together and are separated from the anterior view of external carotid artery. The lingual artery comes superiorly and travels anteriorly to arrive to the digastric triangle. When it arrives to the digastric triangle, it inserts deeply to the mylohyoid muscle, and insert to the tongue. When insert to the tongue, it travels in the inferior surface of your tongue. As you know, your tongue has inferior surface and superior surface. When it arrives to the inferior surface of your tongue, it made deep lingual artery. So, deep lingual artery is the continuous of lingual artery. And also it has some branch. The branch are sublingual branch. Sublingual branch supply the sublingual gland and the area which is located in the floor of the oral cavity. Another branch is submental branch. Submental branch supply the superficial part of the submandibular gland. Okay? Submental branch, sublingual branch, and dorsal branch. Dorsal branch travel at the superior surface of your tongue. So we have an artery in the inferior surface of your tongue, which is named deep lingual artery. Deep lingual artery is the continuous of the same lingual artery. Dorsal branch is traveling at the superior surface of your tongue as a branch of lingual artery, and the third branch is submental branch, which supplies this area in the submental triangle. Okay? It was the lingual artery. Look at the facial artery. Facial artery travel to arrive to the depths of the posterior belly of the gastric muscle, and then travel anteriorly to crosses with the superficial area of the submandibular gland. Here we have the submandibular gland. Submandibular is a salivary gland.
Yes.
The superficial area of submandibular gland crosses with the facial artery. And then the facial artery arrives to the inferior border of the mandible. When it arrives to the inferior border of the mandible, travels superiorly at the superficial part of the masseteric and buccinator muscle, and arrive here in the angle of your eyes, of your orbit. When it arrives to the medial angle of your orbit, it is named angular artery. This artery in this level connects with the branch of the ophthalmic artery. Ophthalmic artery is a branch of internal carotid, from the brain. So you learn that a site for the communication of the external carotid and internal carotid is this area, is the connection of angular artery, which is the continuous of facial artery, and connects with
Ophthalmic.
yes, branch of the ophthalmic
Internal.
artery. Ophthalmic artery is a branch of
Internal
carotid artery.
Can you
Okay?
repeat the root of facial nerve? Can you repeat the root of facial nerve?
Yes,